This is urine coming out of her skin. These are sores that are actually coming out of her skin because the urine is irritating her skin. Now, if you go by the notes will say that she needs 9, what is it, elboplex? 6 elboplex, right? 10 elboplex. Okay, 10 elboplex, 3 Cal-Sol, and 3 capsules of AC carbamide a day, every day, all the time for 12 weeks. In 12 weeks, your bladder will be ready to go what? Boom! Just like that. Now, how do you do that? How are you going to take all this water that's in your body 12 weeks from now and go boom? Standard has a product called Orchex. Orchex. You take about 25 Orchex a day, or you take 15 Orchex, like your notes will say, and 15 collagen C, which is better yet, and I think 3 AC carbamide capsules. No, it's 8B6, I'm sorry. 15 collagen C and 15 Orchex, O-R-C-H-E-X, and 8B6 niacinamide. Those 3 nutritions, 12 weeks from now, you get on and literally will pump and pump and pump your waste of your body out of your body very rapidly. See? And then you'll get the weight out of your body. Now, if we erase the bladder reflex and go back to the heart, what will the heart say? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. See? Now, if she takes care of her bladder, her heart will come right back to 12. Now, all the backups to her heart are perfect. Everything that supports her heart and backs up her hearts and controls her hearts are all perfect. But the bladder is poisoning the body. The body is so heavy with water and poison that the poor heart can hardly pump anymore. It's getting so tired trying to pump that water and that waste that can't get out. It can't get out and has to pump against it. And that's what causes your problems. Eh? And so you got to get your bladder well. That's the secret. But you cannot move that bladder until 12 weeks. So first get on the nutrition for the bladder for 12 weeks. Now, doctors, you might wonder why I spend so much time with this. I would guarantee you that 50% of everybody that you meet in a mall that is overweight has this problem. Because women have sick bladders. They have sick bladders. They have weak bladders. They have small bladders. Men have huge bladders. Men rarely have bladder problems. But women put on weight quickly when they have sick bladders. So there's your answer.
Thank you.
Okay? Who's next? Yeah.
When she had a lot of symptoms she was talking about, maybe it was last year you were talking about checking the ankles and the polarity. You don't necessarily check.
You should check everything on her that I teach you all day long, but we don't have time to go through, every single thing through the whole thing.
You were emphasizing if there are 3 or 5 symptoms that were shown.
Yeah.
A lot of times
Yeah. Well, in her case, you'll find I went through most of it, and you'll find most of it was pretty good, see? But you get that bladder well, and you're going to see some nice things happening to her. And then don't allow them to drink any more what? Water. That's right. And even certain juices can give you trouble, like apple juice. I love apple juice. I could drink it every day, but it's electrically negative. And I do drink it occasionally because I crave it. But on the other hand, the best juices are pineapple juice, pineapple orange juice. You can't drink orange juice alone. It doesn't work. But pineapple orange juice together works. Yes? If you demineralize the water, then it's dead. You have to have electrolytes. You got to move the body in the right direction. You got to keep moving the body this way. See? Let's say we demineralize all your foods. Hey? I hear people saying that. Well, let's demineralize water. Well, let's demineralize foods. Same problem. You got to have nutrition that moves the body in the right direction. The body moves in different directions. If you get this new book, that new book tells you which foods move you directly, indirectly, and which ones are neutral. See? Now you can eat and drink some of the negative foods once in a while, but if you eat too many, you're going to get the body in trouble. See? Good question. Nothing wrong with that, by the way. Okay. This is something throughout the day we'll do this when we get people like that. But she asked, what about the pubic bone? That you have to lie them on their back, take their knees up and see once they pick it up, or just check it directly. And if it is, you have to treat the pubic bone. But most of them don't have that, okay? But if they do have it, you have to treat the pubic bone. You bet. What do you got?
Bulging disc in the lower back, indigestion all the time, and lots of sinus problems.
Okay, bulging disc in the back, sinus trouble, and heart, okay? Hold your arm up tight once. Now, here we go. Right allergy, left allergy, metabolic, yeast, virus, heart. You're going to see a lot of heart patients And that doesn't mean that the heart is bad. It's just the heart is tired, it's slow, it's lazy because something else is not helping the heart. Now, you erase the heart and you go 1, 2, 3, 4, 5. It's supposed to be a 12. Well, that alone will give you sinus trouble. It'll give you headaches. It'll make your heart pound. When people have hearts on the low side, those hearts do this, people. They pound, they pound. I have a lot of patients that have headaches at night because they've been working all day, and at night they sit down in a chair and then that heart starts to pound because they get so tired and they get these pounding headaches. Well, if you find out what caused that heart to go bad, then the pounding will go away. Now, I erase the heart and I'm going to check the back of the head, which is a battery to the heart, then the thyroid to the heart, and then the blood to the heart, and then the adrenal. And all day long, doctors, you will find adrenals. All day long. They're the big backup to the heart. They control the heart. That's your second heart. Now, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You match 1 B6 niacinamide for every pulse, and so that will make it that he will need 10 B6. Now, please, please, never tell your patients that this is a pill test. In many states, it's illegal for a chiropractor or any doctor to say, I'm pill testing. All you're doing is you're matching nutrition against the pulse, is what you're doing. Now, we will erase the adrenal and ask the heart, where will you be, heart, when this guy gets on 10 B6? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, right on the money, see? Okay? Now, we can go on and we'll check the hemoglobin, left coronary, thyroid, 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 adrenal, and then go to the bad fours, which is chemical and lubrication and digestion and pus, and those are good. And then we'll go to the testicle, prostate. Now, the prostate is a gland that you erase it, and you go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Are you angry? Are you mad? He says, yes. People, it happens every time. These people are madder than a hornet. They hate the whole world. They'll beat you up if you get in their way. They'll throw you out of a window. See? Because the prostate gland is the personality of a man. When a man has a healthy prostate gland, watch out. Because he can do anything. He can move the world. He can move his business. He can move his patients and his family because his security and his personality is in his prostate gland. This guy's not happy. He's tired. He's sad. He'd rather not wake up in the morning. He'd rather cry. That's the way he feels. So you get him on his Prostex every day, and slowly on the weeks to come, this happiness and this personality starts to come back. Do you know what this feels like to make somebody happy? Have you ever done that, made somebody happy? Just not treat symptoms, but actually made them happy? This is what I love to do. I ask every patient that came to me over the years, when they would come in for the first time, are you happy? And believe me, sometimes they don't even dare to tell you. Sometimes their family has to tell you. Dad will say, well, yeah, I'm happy. And then the daughter that comes along with dad will say, no, he's not happy. He's mean as ever. See? So anyway, get on some Prostex, about 10 a day. Then when you get real happy, about 6 a day. Now you're back, okay? We're going to check your ankle, pubic bone, 7 cervical, atlas, towers, fingers. Okay. Now turn around. Hold your arm up tight. This is the way you check the spine. You check the skull, and you come right on down, and you check hip, sacrum, hip. The spine is in good shape, but he's got a disc problem. Now, for a herniated disc and a bulging disc, you just take your hand like this, and you scan over it like that, and he's lucky. He does not have a herniated or bulging as far as the body is telling us now. Now, if you want to check if he's got a slip disc, you have to put the arms up with the thumbs backwards. Thumbs backwards. There you go. Ooh. See? That hurt, see? Now, as soon as the arm goes down and he says, ouch, you ask the body, where is that slip disc? And it's right here. Right there. See? Now, that's about what, people? 9th dorsal? See? 10th dorsal, somewhere around there? Now, I do not like to treat disc because discs are always a risk because they can pop, they can bulge, they can crack, they can rip, they can tear, they can bust, and you are in a real problem if you get somebody and you injure somebody. So I do it through the hand. Now watch. I'll show you something really neat. Hold your arm up tight. You check the pinky, the finger, the thumb. Whenever you have a disc problem in the back, all you have to do is adjust the thumbs, and the disc will pull right back in place. Lie on your back on this table. Lie on your back. I'll show you something neat. I can treat just about the entire body through the hands, and we'll do that throughout the day. Raise this leg for me once. Straight out, straight out. Hold it up tight. Raise this one. Raise both legs. Okay, now all you have to do, adjust the thumbs. There they pop. Raise your leg. Raise your right leg. Raise both legs. See the difference? Strong as a horse, see? Now you might say, well, Dr. Versnell, how many treatments must I give him on his thumbs? I mean, there's got to be something. Give him a package deal, see? Here you do. The body will tell you exactly how many thumb treatments will get that disc all the way in place. 1, 2, 3, right there. I can give him 3 today or 3 tomorrow or 1 a day, whatever. But it takes 3 more treatments and that disc will be all the way in place. Now watch what happens when he puts his thumbs back now. Where's the pain? No longer there. It's gone, isn't it? See? You do marvelous things that you could never believe you could do. We get people with torn shoulders. I mean, torn shoulders where they can't even raise their arms, and you adjust their thumb or their finger, and boom, they're up here like nobody's business. They can't even do that with surgery. Okay, you're all set.
Thank you, Rich.
What
I've got a lump with pain on my right side,
right there.
right
okay?
down here. And I have a lot of pain during ovulation. Even sometimes urination is difficult. There's so much pain during ovulation. I have pain in these thumb joints. I can hardly hold things or open things. And I also have noticed I've had decreased memory lately.
Okay. Now, you're a pretty gal. You got a nice petite body, but you have a tendency to stand. I don't know if you people notice it, like this. It's the way she's standing right now. Something is drawing her down. Let's find out what it is. This pain that you got here is compensatory. It's a muscle there. It's nothing but a muscle, see? Okay, here we go. Let's find out what it is. Hold your arm up tight. Is she electrical? Yes. Right allergy, left allergy, metabolic, yeast, virus, heart, blood, hemoglobin, left coronary, thyroid, adrenal. I'm starting to get nervous now. Chemical. See? Where do you live? Nebraska? Illinois. Well, believe me, they got pesticides in Illinois. They got all farm country there. Now, watch what I'm going to do here. I'm going to have you push your head against my hand real hard. Come on, push forward. Push against my hand.
I can't.
She has no strength. I mean, I'm barely pushing against her head. Now, I'm just going to rub down and say, okay, magic, no more pesticides. Okay, push now. See the difference? Feels different, doesn't it? See? Now, the pesticides are attacking her muscles of her body. They're debilitating her muscles of her body. And as a result, the longer you have these chemicals in your body, the more you're going to stand like this and go down to here like a little old lady, see? Now, if we go up to here, we'll go 1, 2, 3, 4, 5, 6. That's normal. 6 is a normal amount of parotid that most people need. That's the average that you'll find. You have to get on 6 parotid every day for 12 weeks, and then all that stiffness. Now, I'm going to make you bad again, okay? Real bad. Pinch my hand. Does that hurt? Huh?
No, but I can't.
Can't strengthen. Okay, now I'm going to get rid of the pesticide, okay? Now, here we go. Strong as a horse, see? Which is proof. You can show your patient that that they have a pesticide because they're weak, and you can rub down and show them what's going to happen to them before you even treat them. And then you collect your money, see? And you collect your money. Okay, now let me check you all over. Here we go. Right allergy, left allergy, metabolic, yeast, virus, heart, blood, hemoglobin, coronary, thyroid, adrenal, and then chemical, which we rub down, lubrication, gut, and pus. So we got through all the bad ones. Ovary, see? Now, rub down on the ovary like that and go 1, 2, 3, 4, 5, 6, 7. She needs 7 Ovex-P a day. Ovex-P is the most wonderful nutrition in the world to recharge and heal weak ovaries. These girls are insecure. They're romantically tired. They're not even sure they care for romance. They often feel insecure in having relationships because their body is not producing enough hormones. See? So your happiness and your joy in your life and your friendship and your closeness to your family and your kids and husband and all that comes from your ovaries, like a man with his prostate, see? So you need 7 Ovex-P a day. Now, eventually, when you're well and the pain is gone and you're feeling wonderful and you're happy and you want to call up Dr. Versnell and say, come on over here, then you can cut it down to about 3 a day, see? See? There's the answer. Now, let's check your iron. Iron is good. Check your vitamins, and your vitamins are good. So everything else is fine. But you were poisoned with some kind of chemical or pesticide. That's what did it. There's your answer. You bet. Okay, come on up quickly. We're just about done, people. We got a free meal for you today waiting. Free meal. Something. What do you got?
Well, I had a tremendous amount of weight gain and joint pain, nauseous, very little energy, and indigestion all the time.
Okay. Now, this gal underneath has got a heart that says, I would like to look like you, and you, right? Okay? And it can be done. And the body will tell you exactly what to do. Now, here you go. If she comes to me and says, Dr. Versnell, I'm interested only in losing weight, this is what I'm going to do for you. I'm going to check your salt reflex. I'm going to check your digestive reflex. I'm going to check your iron reflex and your vitamin reflex. I'm going to check your kidney failure. And the last thing I'm going to check is your bladder. There it is right there. If I touch the bladder, it's going to be sore as heck right there.
Yeah.
See? Always check, always, never push the bladder in the center. Always to the side. Why? Because all the drainage into the bladder is on the left side. It's out here and in here, out here and in here. So you got to remember that the flow of your body should always go this way. And when your bladder is sick, it goes this way, and it can only stop here, and then it begins to swell. And so for 12 weeks, you have to take the bladder program. And then after 12 weeks, get on the 15 Orchex, the 15 collagen C, and the 8B6 niacinamide, and boom! That's what the heart does. It actually does that. The heart and the adrenals go boom, and they just pump and pump and pump and pump and push it out. Now, the only thing that's going to screw it up for her is if she drinks water or coffee. She's got to drink iced tea, lemonade, orange juice with pineapple juice, or pineapple juice alone. If they drink soda pops, the only safe ones that are electrically positive, if they have to drink it, is Sprite and Hires root beer. Those are the only ones that you can drink. But to stay away from water, because water alone can really put the weight on you. Now let's ask the rest of your body what's going on, okay? Now, we go right, left, metabolic, yeast, virus, heart, blood, hemoglobin, left coronary, thyroid, adrenal, chemical, lubrication, digestion, pus, ovary, uterus, master hormone. See how her body is quite healthy? Then the brain, master brain, salt reflex, crown reflex, cerebellum reflex. Now, the last thing we're going to check on her is to see if she needs iron here, vitamin here, and you never want to forget this little reflex over the sacrum, even though she's got a bladder. Is that one sore?
Bad joint, yeah.
Okay, hold this arm up tight. Okay, now, she can hardly hold that arm up, right? Okay, everything on her checks out real good. Let's check her structures. Here we go. Ankle, pubic bone, 7 cervical, atlas, towers. There's their first towers, okay? If you will just lie on your back here, put your head here, feet over there, your body in the middle. Okay, the towers does the same thing as the hands. The towers is the most powerful system in the body that the body uses, that innate uses to move any part of the body. When you kick in the towers, you literally kick in the entire autonomic nervous system, and it literally takes over for the central nervous system and literally pulls the body together, gets organs moving, gets things in place, and does wonderful things for the body without ever being anywhere near to the wrist spot. Right now, she has so much pain in her shoulder here, she can't even hardly hold this sucker up. Now, watch what happens. I'm going to treat that thing, and it's a pad is what it is. It's like a sponge. It's not on the top. It's right on the back top, right here. See? Right here, right there. It's like a sponge. This is not a bone. When you kick this in, you're kicking in big, huge meridian nerves that literally stimulate the nervous system and get the body going. And you can hear it most of the time. It's audible. You take your hand and you fit it behind the skull, and you push your fingers here against it, and you go like this. There it goes. Now the other side. It's almost the same thing as the cervical break. If you know how to give a cervical break, it's the same thing, but your hand is lying into the sponge right here and not the neck. Now, raise your right arm. Hold it up tight. It's better, isn't it? Yeah. See? Now, how many more treatments will she need? Hold your arm up tight. 1, 2, 3, 4, 5, 6. 6 more treatments, and that shoulder is totally well. Without any risk, without any damage to her body. See? Feels better, doesn't it? See? I'll tell you, people, it's marvelous. And no one has techniques like that. I can get people well so quick and so fast. We have one more, I think, or 2 more, is it? Okay, 2 more, and then we're done. Yes?
How do you pulse the bladder when there are 3 different supplements?
Okay, the bladder you don't pulse. The new book, when you get the new book, a lot of you people bought the new book today, the beautiful, colorful book. It'll tell you which organs you may pulse. It'll tell you which organs you may pulse. Because a lot of organs you don't have to pulse, okay? Good question, by the way. Come on over here. What do you got?
I was told I have Crohn's.
Crohn's?
Yeah, and I have excessive diarrhea, and I've noticed that there's blood in the stool. Just tired all the time, can't concentrate.
Okay, the guy's got Crohn's. Now, Crohn's has several causes. You can have parasites, you can have bladder infection, you can have bowel infection. There's a number of things, heart failure. Crohn's just means that the bowel is full of water. That's all. The bowel is being a bladder. Now we got to find out, why is the bowel being a bladder? See? Hold your arm up tight. Here we go. Now, is he electrical? Yes. Right allergy, left allergy, metabolic, yeast, virus, heart. There you go. Now what happens, if it is his heart, I'll be able to prove it in a minute, what happens is that everything goes down. He's not pumping water up to the kidneys, but it's going down. And then the water gets in the bowel and literally tears that bowel up, see? Okay, so erase the heart and start counting. 1, 2, 3, 4, 5, 6. Okay, by erasing the heart, you can check where the water is, and it's right here. This is where you got all your trouble, right in here. You have pain there?
Yeah.
Okay, that's where his Crohn's is, right here, see? Now, we got to find out, why did his heart do that? So let's go on. Is it the battery of the brain? Is it his thyroid? Is it his hemoglobin? Is it his adrenals? And more often than not, it will be the adrenals, at least for a beginner. As you fine-tune the body, you'll find other things. Now, I erase the adrenal and I go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. That's bad. Those adrenals are really tired. They're really tired. They need some real help now. So you have to match that pulse of 12 with 12B6 niacinamide. And then when you're gone along about 8 or 12 weeks, have your doctor recheck your pulse, and it'll probably be 5 or 6. And eventually you'll be on 3 or 4 or 5 a day all the time, so it never comes back. Now, you erase the adrenal one more time, go back to the heart, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and his heart's back to normal. Now his heart can pull the water up, pull it up. Now, I didn't count the bowel, but if you weaken him again, I'll weaken him again. I'll literally weaken you, and I'll go to the bowel and count. 1, 2, 3. His bowel is supposed to be what? 10. Everything's a 10, other than what I told you. You erase the adrenals and go back to the bowel. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. See? Now, he's got a bowel that's raw. It's so raw, it's so sore, it's giving him loose bowels. So you have to put him on the Crohn's treatment, which is in the long book. The nice long book that they're selling back there. You look at that, and it'll tell you to put the patient on 3 different things. 6 gastrics, 6 ochrapepsin, and 6 linum B6 every day, all the time for 12 weeks, and that lines that bowel and heals that bowel so that eventually you won't have a loose bowel. But the bottom line is, the cause of your trouble was your adrenals failed, your heart. And then your heart went down, and you got water in that bowel, and that water ate up your bowel. Now, we got to correct the cause, but we got to treat the symptom, which is the Crohn's. Okay? Got it?
Yeah.
Okay.
Thank you.
You bet. Yes? Yeah, the heart can have anything, but the 4 backups to the heart is the brain, the thyroid, the hemoglobin, and the adrenals. 9 out of 10 times, one of those 4 or more will cause the trouble. But it doesn't have to be. It could be chemical. I've had patients whose hearts were knocked out by chemicals. It could be prostate or bladder. It doesn't have to be those 4. If you go over the patient, right, left, all the way down, the second time around, if the heart shows up, you have to give them Cardio Plus. That'll be in your notes too, okay? Now, come on over here. Tell us what you got.
Okay. I have 2 rashes that goes down my arm and my back. It gets better and worse. I also have a rash over my eyes. Also, the balls of my feet hurt when I walk.
Okay? Now, when the balls of the feet hurt, do they sweat?
No.
Okay. Okay, here we go. Let's see what she's got. Right allergy, left allergy, metabolic, yeast, virus, heart, blood, hemoglobin, coronary. Those 9 are out of the way. Now you go thyroid T1, T4, T3, and adrenal. Very good. Chemical, there you are, right there. Well, you know I'm in chemical country when I'm here today, I tell you. Now, I'm going to erase this and ask your body, is that chemical in your feet? And it says yes. If I go up on this, nothing's going to happen, see? So we know that the chemical is attacking the lymphatics of the feet. She would literally get arthritis in her body from the chemicals that she's got in her body. Now, if you want to know, per out at 6 a day is a general average, but occasionally you will find one that'll be higher. That's why it pays to pulse it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. I've seen them go as high as 20 a day or 30 a day, I'm not sure. But 12 a day is high for a little petite gal like you. You are loaded with chemicals or pesticides or something. You live on a farm or out in the country? No?
No.
Somebody trying to kill you? Okay, well anyway, that's the reason behind that. Now let's go on, and we're going to check your body now for ovary, uterus, master hormone, then master brain, salt reflex, crown reflex, cerebellum. That's good. We'll check the kidneys, check the bladder, we'll check the iron, check the vitamins. Now, you need some vitamins. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. That's a lot of vitamins. So 12 is your pulse. You match that with Catalin. You take 12 Catalin a day. Now, doctors don't use any other vitamin besides Catalin because Catalin is not the same as other vitamins. It's a phytochemical. It has an electrical charge that is totally different than anything you'll ever buy on the market. And it has no side effects. And the results that you get are absolutely fabulous. And so I want you to get on 12 of those a day, and then about 12 weeks from now, have your doctor recheck the pulse so that that number comes down. Okay. Other than that, you're in pretty good shape. Okay, one more, and then we're done. Yeah. The rash that she had all over her body that she's talking about came from the chemicals. Yeah, you bet. Now, why would she have a rash? Because she's producing what? Electricity to burn it up, see? Sure. Most of the time, a rash or a hive is nothing but electricity being produced by the body to burn up the chemical. Okay.
Okay, I have a lot of problem with root canals. I mean, I've had tooth decay, have very poor eyesight, and I seem to have a history of angina and acute mountain sickness.
Okay. Now, she says she has eyesight problems. We'll go after the rest in just a moment. What I want you to do, dear, is to shut your eyes. Just close them.
I also have tendonitis in this arm.
Okay. She has tendonitis in her arm. We can't use that arm. Hold this arm up tight. Here we go. Now, close your eyes. Now you go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. What's wrong with her eyes? Are they too weak or too strong? They're too strong. She's over a 10. Now, if you look at her, she looks like this. Her eyes are bulging out of her head. I mean, she's ready. See? They're just bulging. Something in her body is literally producing so much electricity that it's just literally pushing her eyes right out of her body. Now, I get people every once in a while whose eyes are super sensitive, super strong. Their eyesight is penetrating so far that they can't hardly stand it. Everything that they look at just bothers them. See? Now, there are 3 nerves that you have to check, and it's always in the books. It's in both of the books that you find. And that is this. You want to check the pineal gland between the eyebrows right here. The pineal gland is the towers to the eyes. It's the towers. It controls all the nerves in the back of the eye. And then you check the crown reflex, which feeds the nutrition to the nerves of the eye so that they're healthy. And then you check the cerebellum. Now, all the nerves to her eyes are what? Healthy. But she's producing too much electricity. Now, what is the organ in the body that produces electricity? The heart. Okay, here we go. Right allergy, left allergy, metabolic, yeast, virus, heart. Now, you erase the heart. Now watch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 30, 30, 30. There it is right there. See? She's a 30. Now, she's supposed to be a 12. Now, she's just producing so much electricity that those eyes are just bulging. Now, this gal is happy. She's on the move all the time, boy. I'll tell you, she's in the crowd, see? And she's automatically that way because her heart makes her that way. She gets up early in the morning, goes to bed late at night. She's the person that's mowing the lawn outdoors, the poor neighbor lady. She's got a heart that's at a 2, and she can't figure out why she can't do that, see? These kind of people get a lot of work done. Now, occasionally, they get so tired of racing and racing and racing that they just, even if they're going 30, they get tired. So you will get those kind of people. But they start out moving like crazy. I got a hunch that she's a mover because I was out there watching this video here, and she was all over my shoulder, see? And it's because she's so active. She's just so active, see? Now, we got to erase the heart, and we're going to ask the body now, where did this come from? Where did this heart get so fast? Where did the heart make so much electricity? Is it the back of the brain? Is it the thyroid? Is it hemoglobin? Is it adrenal? Now, here's a situation where the 4 things that operate the heart are fine. So let's go through her. Right allergy, left allergy, metabolic, yeast, virus, heart, blood, hemoglobin, left coronary, thyroid, adrenal, chemical. I'm going to get out of town as soon as this seminar is over.
I'm from Aluminum Town.
You what?
From Aluminum Town.
She's from Aluminum Town, she says. See? Okay. Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 parotid. It's unheard of, people. It's unheard of. She is so full of chemicals that it's just destroying her body. Now if I check her eyes, or her heart, I should say, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and then go to her eyes, which were real high, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. See, the eyes now slowed down, the heart now slowed down, just with one thing, the parotid, 15 a day, see? All right. So let's check your hormones. Ovary, uterus, master hormone. I think we checked the brain already. Check the kidney, the bladder. Check her for heavy iron. Check her for catalin. Everything else is fine. It's totally chemical. Now, which is your bad arm? And I used it, didn't I? Look at here, see? So that arm went bad because of the chemicals, see? All right, so there's your answer.
Well, thank you. Very
You're
nice.
welcome. Mark, would you want to come up here, please?